Welcome everybody to the third session of today's conference. This session deals with the Israeli-Palestinian conflict and its impacts. My name is Yore Kedem. I'm going to be the discussant in this session. Our first presenter, Scott Howard, will present on the impact of Israeli-Arab small arms evolution on the conflict. Our second presenter, Stephanie Garcia, will present the Israeli-Palestinian conflict, psychological effects on population's youth. And Roya Rochelle will present on women's and children's healthcare in Israel and Palestine. So I welcome Scott to begin the session.
Hi, everyone. Let me just get my screen up. All right, I think that should be working, hopefully. Can't really tell. So I'm Scott Howard. I'm glad to be here. So my presentation is on the impact of Israeli-Arab small arms on the evolution of such during the conflict. So what we're going to talk about is the importance of small arms and what they are, if you don't know, eras of small arms in relation to the conflict and the conflict eras, the major sources of small arms to the Middle East, major differences between the Israeli and Arab arsenals, and the advantages that the Israelis had over Arabs in the small arms category. So first of all, what are small arms and why are they important? So small arms are defined as the man-portable firearms capable of being used by one person. So small arms are very important on the modern battlefield, especially in urban settings where there was a lot of fighting. So in places like the Negev Desert, tanks, artillery, and aircraft really reign supreme because of their long-range effectiveness, as well as relative hardiness in desert conditions. But the problem with tanks and artillery and aircraft and such is they're expensive. They're harder to get. It's harder to train people to use them effectively compared to small arms, which can be used by anyone. They're relatively cheap, more effective and precise in urban conditions, albeit with a much shorter range. So the eras that I've kind of defined in the conflict are initial years, 40s to 50s, more defensive actions taken by Israel in the 60s
Scott,
and 70s.
Are you showing us a PowerPoint presentation? Because we can't see it.
Really? Oh, yes, I do.
I'm only getting a black screen.
That's a problem. Let me see here. Yeah, thank you for letting me know. Are we seeing it now?
Still not.
That's a problem. Sorry, I don't share my screen very often on Zoom, unfortunately.
Try it again.
Share screen. There. Can we see it now?
Still black screen. Okay, you can just talk. We'll listen. We'll be good listeners.
Yeah, I'm so sorry.
If you want to email it to me, I can try to share it while you begin. Unless that will take, it's up to you.
That might take a minute. I'll just talk then. Sorry, everyone. I thought I had this together. So anyway, back to eras of the conflict. So I've defined the eras as the initial years in the 40s and 50s, defensive actions in the 60s and 70s, more offensive actions by Israel in the 80s and 90s, and general insurgent actions from the 2000s to really the present day. So there are a couple major sources of military aid to the Middle East. The number one sources, unsurprisingly, are the US and Soviet Union. Although the US aid really only started to pick up in the 70s, while Soviet aid started back in the 50s, and continued on to the collapse of the Soviet Union in the 90s. According to a CIA report on the Soviet military aid to the United Arab Republic, between 55 and 66, the Soviet Union supplied just over $1 billion worth of military aid to the UAR. And adjusted for inflation today, this is about $9 billion. So not a small operation. Compared to the United States aid, since the 70s, the US has sent $34.5 billion in military aid to Israel. Now, most of this isn't small arms. A large, high dollar amount items like tanks and missile defense systems and other things like that, heavy equipment, make up the bulk of it. But with the low relative cost of small arms and the large amount of aid sent, this amounts to a lot of American guns in the hands of Israeli soldiers. So at the time, there's not a lot of aid to Syria and Lebanon, which is where Israel was fighting during some of these years. So Israel has fought, standing professional armies as well as, more insurgent guerrilla fighter types. And the disparity of the firearms fielded by both of these groups is quite substantial. Definitely standing armies like the Egyptians and the Jordanians would have new production Soviet aid, so a lot of AK platforms, versus the Israeli in-house production firearms as well as US aid. So very, almost equivalent there. But the big issue was that as the conflict moved on, Israel got, they updated their weapons. They got new ones. If something broke, they just fixed it or got rid of it. And whereas the insurgent guerrilla fighters kind of get what you get. If what you have is an AK from the 50s that's been fighting for 40 years, that's kind of what you have. And, things degrade over time. So there's definitely a disparity in the arms and just the quality and reliability of those fielded. So really the main Israeli advantages using small arms is most of their soldiers were trained to better standards. More time on the range, more time drilling with their officers, gave them advantages in any squad v squad interactions. Israel also had, a lot of US military aid coming in, but they also had the technical experience to modify any imported arms to better suit their needs. Maybe the M16s they got weren't necessarily sandproof. They can make a few modifications here and there to really change it up to exactly what they needed, which gives them another advantage. They also have in-house Israeli weapons industries and Israeli military industries who do a lot of R&D and production to support the Israeli arsenals, and have come out with the Israeli firearms that we see today fielded, like the Tavor bullpup rifle, the Galil, as well as the Negev light machine gun. And on the other side, most of the Arab world had very limited in-house production, and they relied more heavily on the foreign military aid. So for the comparative arsenals in these eras that I've defined, first we start out with the 40s and 50s and the conflicts that we see in that time period. Really both sides were fielding World War II surplus. The Israelis had anything that the US could send over and any allied surplus, things like M1 Garands, Lee Enfield rifles, versus more Soviet aid on the Arab side, like Mosin Nagant rifles, Tokarev pistols, things that were fielded during World War II. So there's not a lot of difference there in these early days. But once we move on to the 60s and 70s, then we start seeing the more modern firearms hitting the battlefield, like the M16s and AK-47s. So the M16s and Galil Israeli production rifles and the Uzi submachine guns were fielded by the Israeli side. So most of their arsenal was either in-house built or made up of Western arms. and really encompassed most of, all the types of firearms, like submachine guns, heavy machine guns, select fire rifles, things like that. Whereas the Arab sides were really using the AK platform, had taken off in the Soviet Union, and very similar firearms were fielded for pretty much every application. Once we move into the 80s and 90s, we still see this pattern going on where the Arab sides using AK-47s, the new 74s, other AK derivatives, which come mostly from Soviet Union aid stocks and other Chinese aid. Whereas the Israelis still fielding M16s, Galils, Uzis, also are starting to come out with the Negevs and Tavors, which are brand new high-tech weapons platforms that, on a squad versus squad basis, the advantage goes to the Israelis with the new rifles. And in the last era, from the 2000s to present day, the Israelis are still upgrading their firearms with, things like high quality scopes, laser sights, more reliable, worked out, magazines, things like that. Whereas any guerrilla fighters, like I mentioned earlier, have to deal with what they have. If you have to dig an AK out of the ground and dust it off and hope it works, that's what you have to do. But a lot of Israeli weapons, they're trying to phase out the M16 to be more reliant on in-house production for things like the Tavor, which, being a more compact rifle with the same accuracy and velocity standards as the M16, really lends itself to high performance in urban areas. So that's smaller arms, although bigger things like the US M2 50 caliber machine gun still being used by the Israelis, but for the majority of small arms, they're trying to get into personal in-house production. So the bottom line is that the Israelis held pretty much every advantage in this field. They had constant R&D, led to much more modern weapons suited to their needs. And having the most modern weapons on the field, purpose-built in Israel, gives them a major advantage over any enemies that have weapons that, oh yeah, they'll work pretty much everywhere, but not perfectly everywhere. And this supports Israeli victories in squad or, small arms conflicts. And definitely the ability to manufacture their own weapons and ammunitions, mostly by IMI and IWI, really lets Israel rely less on any outside aid for the most basic armament of their soldiers. So small arms technology is part of the reason why Israel can really punch above their weight class militarily compared to the other Arab nations in their conflicts. That's all I have. Thank you.
Thank you, Scott. I think this is a really interesting presentation, especially in the context of these conferences. This is not something people usually talk about, and that was really, really in depth, and in a historical context, I thought it was really, really interesting perspective on this. We will just generally, I didn't mention this in the beginning, but if I see that you're going a little bit over your time, Scott was excellent, was actually below the time allotted. But if I will see that you're going a little bit above your time, I will send you a message through the chat in the Zoom, just to let you know to kind of get your presentation a little bit shortened. But I would like to go next to our next presenter, which is Stephanie Gerst, is going to tell us about women's and children's healthcare in Israel and Palestine.
Yeah, I have a presentation to share, so 1 second. Can you all see my screen?
Yes.
Okay. Still? Okay, so my name is Roya, and I did my project on women's and children's healthcare in Israel and Palestine. So I just wanted to give a little bit of background information about the healthcare systems in Israel and Palestine before getting started, because I think it can help understand some information I'm going to talk about later. So after the Oslo Peace Accords were implemented, it gave the Palestinian Authority responsibility for the administration of healthcare in both the Gaza Strip and West Bank. But since Hamas's takeover of Gaza, the PA and Hamas have had constant struggles over healthcare and numerous other things. And so Hamas has accused the PA a number of times of cutting medical aid to the Gaza Strip, and the PA denies this from happening. And so there's this constant back and forth there. And then also the idea that the PA has sole responsibility of their own healthcare system is kind of confusing and a little muddy, because some parts of Palestinian healthcare is still controlled by Israel. So little things like pharmaceutical imports and exports are still overlooked, and like healthcare expenditures and border crossings. And another thing that I should mention is that Palestine receives a lot of its funding for healthcare from outside sources. So the United Nations Relief and Works Agency for Palestinian refugees finances over about a quarter of healthcare spending for Palestinians. And Palestine also receives a considerable amount of funding from the United States. So in the past, Palestine has received over $250 million from the United States for their healthcare system. And this changed in 2018 because Donald Trump withheld funding to Palestine in an effort to make Palestine more likely to agree to the peace plan. And this cut also meant that the US no longer gave money to the United Nations to support Palestine in their health clinics, which was about $300 million cut from their budget. And the US also cut an additional $30 million in planned aid for their East Jerusalem hospital network, which are hospitals that provide a lot of care for Palestinians. And the Biden administration, though, has said that they plan to restore the aid in the upcoming year, though. So that's hopeful. And it's also pretty common for residents of the West Bank to be referred to Israeli hospitals, because Palestinian hospitals oftentimes don't have the resources to treat patients for what they consider more complex procedures, which oftentimes relates to obstetrics or pediatrics and cancer treatment. So here are just some healthcare statistics from Palestine and Israel. And you can see that Palestinian women live almost 10 years shorter on average and have a much higher infant mortality rate, about 4 times higher than Israel. And the overall government expenditure on healthcare is pretty low compared to Israel's about $2,000 and Palestine's $246 per person. So this study that I looked at first was about maternal and child access to healthcare. And the purpose of this study was to establish the relationship between the intensity of conflict and how it affected maternal and child healthcare access in the Palestinian territories. And this study focused on prenatal services, pregnancy complications, and postpartum services over the course of about 12 years in Palestine. And they use vaccinations as a proxy for determining postpartum healthcare services. And so in this study, they defined the intensity of conflict as the monthly death rates of non-combatants for each region. And this is shown on the graph on the left, and it also includes some major events that occurred in Palestine and how they related to the intensity of conflict. And they also found that conflict intensity had the biggest impact on children's immunization and access to maternal health care. So in the graph on the right, the dashed line is a normalized version of the intensity of conflict for both the West Bank and Gaza. And from the graph, you can see that when the intensity of conflict is at its lowest, the amount of prenatal visits peaks. And for cesarean deliveries, they're also at their lowest when the intensity of conflict is at its lowest. And cesarean deliveries are commonly used as an indicator of maternal health, since cesarean deliveries typically aren't done when there are complications if they aren't planned. And so the study also found out that another important factor is locality. So the Gaza Strip is a pretty small area, and since there aren't nearly as many checkpoints like in the West Bank, routine access to prenatal care and immunization already typically occurs at a higher level compared to the West Bank. But in terms of more complicated procedures like C-sections, which require specialized care and aftercare for both the mother and the baby, that might not be available in the Gaza Strip and require those patients to be moved to the West Bank or East Jerusalem hospitals. So the next study I looked at was about barriers to healthcare services for Palestinian women living in Israel. And this study looked at how residency status affected access to healthcare. So before jumping into the details of the study, there's something I guess I should mention. So up until about 2003, the family unification law said that Palestinian women from the occupied Palestinian territories who did migrate to Israel following the marriage of a Palestinian citizen of Israel, they were eligible for universal Israeli healthcare services. But in 2003, late 2003, Israel made an amendment to its citizenship and entry law, or the family reunification order, that ended the possibility of these migrating spouses attaining residency. And the order was supposed to be a temporary security measure that lasted about a year, but it's been in effect ever since and affects about 25,000 people, and mostly women and children. And although in 2005, some improvements to the family reunification order did happen, the Israeli government agreed to provide about 250 family unification permits a year. These changes allowed some women and children to obtain temporary residency, but they don't apply to residents of Gaza. And so in the study, they interviewed Palestinian women living in Israel, and they asked them various questions about their lives in Israel. And the table on the left is of the data that the study collected. And the table shows that all of the women that were interviewed lacked permanent residency in Israel and were denied access to universal healthcare services. And 2/3 of the women paid for private health insurance and received very basic healthcare services through sick funds, while about 1/3 had no insurance whatsoever. And so many of the women don't have any healthcare insurance or anything like that, but the majority do have to pay high fees for private health insurance that provides limited access to certain services. And in some cases where husbands and families can't afford fees for healthcare insurance, this causes like a really bad issue, since women can't go to pregnancy follow-up exam visits or even have children in certain hospitals. And so one woman that was living in Israel, she was a Palestinian woman, said that while she was in labor, they made sure that she would be able to pay for her treatment. And since she wasn't a resident, that took over an hour and a half, and she had to wait before she could be accepted into the hospital. And another woman mentioned that she would leave Israel to get prenatal health care, even though she did reside in Israel. And this quote on the right is from one of the women that they interviewed. And it said that she had to go once a month to Jenin and sometimes stay 1 or 2 weeks there for a follow-up. And in the last month of her pregnancy, she stopped going because it was difficult and it was very far, and she had to cross a military checkpoint. But those were the months that she needed the follow-up care the most. The last study that I looked at was about access to healthcare for Palestinian children. And so this study looked at the various factors that can affect children's access to healthcare. And the first factor was, again, permits. So the occupied Palestinian territories are divided into multiple areas. And if a patient is transferred from one area to another, usually patients are referred to East Jerusalem, a special permit has to be obtained for this. So this permit comes from Israel, and frequently the permits are refused on security grounds, and only about 54% of permits are approved annually. And so the lack of approved permits affects Palestinian children, especially since the Augusta Victoria Hospital in East Jerusalem offers the only oncology, radiation, and nephrology services for children in the Palestinian territories. And in addition to the issue of getting these permits, the way that people find out if their permit was approved is pretty flawed. So patients usually only find out if their application was successful the evening before they're due to travel for their treatment. And so this means that some families will have to make accommodations to be able to leave at any time, which most people aren't able to do. And also the problem of permits plays into like checkpoints. So since the Israeli government doesn't normally allow Palestinian patients, even in emergency cases, to cross certain checkpoints and to freely enter from West Bank, even in a Palestinian registered Red Crescent ambulance. And so if a patient is being transferred from the West Bank into Jerusalem, the patient sometimes has to be transferred from the Palestinian ambulance into an Israeli ambulance and then back into a Palestinian ambulance at a checkpoint. And this study also mentioned a specific story of a 24-year-old mother from Gaza who was permitted to travel from Jerusalem to give birth to her triplets who were in pretty bad condition. And her permit expired after 3 days. And so she had to return to Gaza without her children. And then she wasn't there for when her first 2 children died, and they had to call her and tell her. And the doctors believed that the 2 children who did die had a condition for the best preventative steps would have been breastfeeding. And the figure on the right here shows that both neonatal mortality and infant mortality increased in 2006, but post-neonatal mortality decreased. And they reasoned that the increases occurred due to the disruption that was occurring during the takeover of Hamas, but they were unsure as to why post-neonatal mortality decreased around this time. And this is just a slide like asking questions about how can we improve healthcare in Palestine, and some of the ways could be expanding the scope of treatment provided by Palestinian hospitals, ensuring that they have consistent funding, and also negotiating better border relations in regards to emergency care and services. That's all I have.
Thank you so much, Roya, for an excellent presentation. I thought all 3 presentations were stellar. What I think we will do, we have a little bit of time, is I'll ask each presenter a couple of questions to start the conversation, and then we will go to the general public for more questions. But actually I see that Professor Aronoff already has questions to everybody. So how about Yael, you start?
You go ahead first. Yeah, very interesting presentations. You go first, and then I'll go.
Okay, so my first questions will go by order. Scott, here's a couple of questions that I'd like you to answer. Do you think, would you say that Israel's more developed small arm industry has been a benefit for its military, or would the advantage come mainly from the large arm